All right, hey everyone, Dr. Donahue back here. So talking about the third condition today, SI joint dysfunction, right? So dysfunction meaning abnormal movement, just not functioning right. So signs and symptoms of that again, pain from sit to stand, but you probably aren't going to have like an obstruction or something that you feel stuck with. You're going to have some pain there. Pain with sitting for longer periods. The pain is usually going to be a little bit lower than like in the middle. So it's usually going to be on one side and it's going to be a little bit lower. So that bump that we talked about a while back, it's going to be right in that area. If you point right to that bump here, that could be a sign of an SI joint issue. So coming and looking at the SI joint, so it's your sacroiliac joint, right? So your iliac or your ilium and your sacrum here. So you have your sacroiliac joint. It's a mobile joint, but it doesn't allow for too much motion here, and it's a load bearing joint. So it transfers the weight from the upper to the lower extremity and vice versa. So if you're having any of these symptoms, especially from sit to stand, this is going to be a good exercise for you to work on. So we'll work on hip hinging here. Because so typically when somebody stands up, they're going to do something like this. They're going to go forward and then back, and that's not going to help your cause any. So what we want to do is we want to focus on hinging at our hips here. So when we sit down, we're going to go here. We're going to keep a nice neutral flat back here. So we're going to stay here. You can use your hands here and then sit down. So when you stand up though, we want to get our legs under us. We're going to scoot to the edge of the bench here, and then you're going to drive through your legs, and you're going to stand up and keep a nice neutral back again. So same thing here. And if you need to, you can use your hands to help you as well. So you just put them here. So instead of this going up, you're going here. You're going to keep it neutral back, and you're just going to push yourself up. So that's a simple way to start working on some stuff. If you're having some SI joint pain, a lot of it's coming from the hip hinge. So retraining that pattern, doing some of that stuff will help with that issue. Thanks for watching. We'll see you next week.